Thank you. So, hello everyone. My name is Melissa Moon, and today I'll be the facilitator for this session. So, today's agenda will include introductions and announcements, an interactive discussion with Dr. Chastain about overcoming barriers to Hep C treatment. Um, oh, it skipped ahead. Excuse me. And case presentations, and of course, closing remarks. So just a few quick reminders. We do need everyone to take a minute to register with our accrediting body, the Southeast AETC. Registration is required for CE and grants you access to numerous additional resources. You can also utilize the QR code pictured here on the left of the slide or the website listed on the slide to register. We will give everyone a moment to register. All right. So first, some in-chat introductions as well as some brief announcements. Before we get started, I would like everyone to take a second to introduce yourself in the chat. Please include your name, your role, your organization, and if this is your first echo session with us. And we'll give everybody a minute or two to do this. Oh, yay. So Chelsea says this is her first echo session. Welcome, Chelsea. Oh, Kayla is also, this is her first session. Awesome. Well, welcome everyone, and y'all can continue to put your introductions in the chat. I am now going to turn this over to our subject matter expert, Dr. Chastain, for an interactive discussion on overcoming barriers to HCV treatment. Dr. Chastain, are you ready to share your screen?
I am. I'm going to stop and move over to another screen. So we'll all wait here with bated breath here for just a moment. See if we get everything to work. All right, Melissa, are you able to see my screen?
Yes.
All right, we got one challenge down. So welcome to all of you who were able to join us either for the first time or for many times. My name is Cody Chastain. I'm a infectious diseases physician and internal medicine physician at Vanderbilt University Medical Center. And I'm also the principal investigator for the Southeast AIDS Education Training Center. And so today, I actually want to do something a little bit different. Most of you who are used to joining us are ready for us to move into a didactic component, which didactics are great, didactics are wonderful, and they give us an opportunity to share information with everybody and make sure it's structured in such a way that everybody has access to equal information, but it's not always necessarily the best for promoting a conversation. And so I also recognize that there's a lot of really rich experience that's on the call today. Nurses, coordinators, providers, NPs, physicians, others. And so I really want to, pharmacists as well. No one's left out here, but I just really want to highlight there's a lot that you bring to the table. So I'm going to try to promote a little bit more interaction, and more interaction does not require you to turn on your camera, and it does not require you to come off mute. I keep on waiting for more hearts and thumbs up to come up with that, because I know that it's sometimes scary when we don't have safety in the group as far as who all is here. So I want to promote more engagement today, but I also want to respect your distance if you feel more comfortable in that way. That being said, there'll definitely be opportunities for us to discuss and for you all to come on. So I've got a QR code here on the slide, and part of the reason is that, and the reason that we switched over from one slide deck to another is that I'm actually presenting from an interactive tool called Mentimeter or Menti. And so I'm going to give you two different options. I know that you're logged on through Zoom, so I know you're all accessing either through a computer or a smartphone. So I'm going to give you one of two options. You can either open a new web browser window adjacent to this one that you're watching on from your computer, and you can go to www.menti.com, and they'll ask you for a code. And you can put in the code 15753433. That's listed at the top of this slide or on the left side of this slide. The instructions for joining will end up being on every subsequent slide. So if you miss out or drop off for some reason, it'll be easy to rejoin. Alternatively, if you would prefer to actually have your phone or another mobile device to connect with, you can use your phone, iPad, tablet, and actually scan the QR code on the right. This is not the same QR code, and this is not the same logon that we just showed you for the SEATC. This is actually just for this presentation. So I want to give people another chance. You can either open up a new web browser, go to menti.com, enter the code 15753433. You can alternatively use QR code from mobile. So I've got some hearts flying, got some thumbs up. I don't have any thumbs down quite yet. I will note that I'm also keeping an eye on other aspects, and Melissa and Anastasia can keep me honest as far as the chat box, as far as making sure that I'm not missing other things. All right. I think I've given people enough time to play along with it. So first of all, I'm going to try something that I've not tried previously. I want to see if we can get a geographic spread here as far as where people are. So I actually can't see what it is on your view, but my hope is for you to put a dot or a pin on where you are geographically joining from today. And I know that there was at least one person that said in the chat box they're from Florida, so I'm expecting to see a dot off the screen there to the bottom. All right, we got some Memphis folks, we've got some Cumberland Plateau folks, we've got some folks in the Metro Nashville area. There we go. We got some, maybe that's Rajiv down in the Carolinas, South Carolina. We've got some East Tennessee folks. So the first thing I want to highlight here is that there is actually a lot of geographic expertise here. I love to see this, because ultimately what we are trying to do with the program is to connect providers in different places. I know we all love being in person for some things, but it's also great to be able to connect virtually. And this type of programming could not happen without virtual connection. So I absolutely love this. Also, this is a less scary way to, you can't get it wrong with putting the dot on the map. All right, well, that's fun. That actually works. That's a good thing for me to know for next time. So we're going to move to a different interactivity slide. Okay, there are 3 statements on this slide, and I want you to click on each of these as far as share how much you agree with each statement. The far right is that you strongly agree with the statement. The far left, the dot, is that you strongly disagree with the statement. And as people participate on this slide, it should kind of move back and forth about where most people are feeling. So the first is, my clients or patients have many barriers to accessing hepatitis C treatment. That you, as a navigator, as an advocate, as a provider, experience many barriers in assisting clients and patients with HCV treatment. And then finally, a little bit more positively framed, that you or I and or your team can navigate barriers to HCV treatment. So got 17 people playing along. I'm actually really enthusiastic about this because we've actually got a great group playing along here, as long as I don't make you speak or turn on your camera. So let me just kind of highlight here how I'm interpreting this, is that a lot of you notice that your clients or patients have many barriers, and that's plural. It's not one barrier, it's many barriers to accessing hepatitis C treatment. And the average here is about 4.1 on a 5-point scale, but some of you answered 5. Some of you might have answered closer over to 3. But I think what's safe to say is that we as a group feel that there are definitely a lot of barriers. Provider experience varies a lot, it looks like, in this group. Whether you're a navigator, whether you're an advocate, whether you're a prescribing provider, another health professional, it really looks like this is kind of middling, is that it sounds like a lot of you experience at least some barriers, but perhaps less than your patients do. But what I love most of all is actually the answer to the last one, is that most of you feel that you and your team can navigate barriers to hepatitis C treatment. And that's honestly what this group is all about, is actually trying to provide education, support, discussion, and other collateral to help support you navigate what those barriers are. A lot of times we focus on diagnostic, laboratory interpretation, treatment selection, and clinical management. But I also want to highlight that we're here to support with any and all of those things. And that's why it's great to have a subject matter expert like Dr. Allen with us to comment on pharmacologic barriers, but also system barriers. And also we have 2 different subject matter experts between myself and Dr. Alfaro Cruz, who can really speak to different patient populations. And so we really want to mitigate those barriers as much as possible. All right. No answer is incorrect. So we're pivoting away from what you think as far as whether you agree or disagree. This is a word cloud. So you can put a single word, you can put multiple words, you can put in multiple entry options. What barriers do you, as a health professional and or your clients or patients, encounter to hepatitis C treatment? If a word is repeated multiple times, it will stay pretty big. If only one person mentions something, it will become relatively smaller as we get more responses. And I'd encourage you actually to enter multiple entries here. So insurance, both insurance coverage for genotype, but also the fact that sometimes we don't collect genotypes. Education, awareness, that might be patient education, might be provider education. Transportation, phone service. I assume that long waiting times probably have to do with access to providers. Some more things about insurance, some more about transportation. That's an interesting one because we could probably talk about delivery of hepatitis C care through telemedicine on a future session. Stigma, identifying stigma as a barrier. Incarceration or housing status are 2 that popped up. Incarceration being split out simply because of this not being a smart system. Adherence being a barrier for some. Cost being a barrier. Other medical comorbidities, particularly substance use. Access to treatment, I think, is popping up in a couple different places, whether it be insurance barriers, long wait times, physician available to treat. All those probably have a relationship to access as well as that insurance says. Some people all put the cost, price, those different things are popping up in different ways. I think some important ones are other real life factors, things like childcare, having access to other support structures allow people to focus on different elements of their health. So these are all very real, and I think you all bring a lot of expertise in this context. And while I'm thinking about that expertise, before I move on to the next slide, I'm going to go back to old-fashioned interactivity. We opened up that chat box on Zoom. I want you to go back to the chat box on Zoom, and I want you to put down how many years of experience you have as either a healthcare professional, advocate, and or navigator. That you can include your years of training. You can include years working in a space different than what you're doing. I just want to see a row of numbers there in the chat box and give everybody a chance. So it might be 1, it might be 5, it might be 25. Just want to see a bunch of numbers that start running in here. We got 30 that were put in here on the word cloud, so I'll add that in here. Whoa, we got some experienced folks here. Love it. Love this. Love this. So we are I'm looking over here at the other list here on the side. And what I can say, and what I really want to do is just to highlight this and to honor this as a group, is that we are at this point approximately sitting around 300 years of experience in care that have been listed. It's about 300 years of delivering healthcare in some capacity, whether it be as a nurse, a physician, as an advocate, as a provider. So just why I wanted to highlight that and honor that and note that is that is just tremendous. And you all bring an incredible amount of context, experience, and perspective. And that is really, really important to highlight because me sitting here, even if I add up all of my years of training and other things, like my from the start of medical school to where I sit right now, we're talking about 20. And so 20, last time I checked, is quite a bit less than 300. So while I might have some additional specific areas of focus or expertise, and I'm sure Dr. Allen and Dr. Cruz would agree, we bring perspective, but we don't bring all the answers. And so this is really a collaboration and also an opportunity for us all to contribute in a lot of different ways. So really fantastic and amazing. All right, going away from Zoom back onto the Menti platform. I want you to rank the impact of barriers to treatment on the people you care for or that you advocate for or that you navigate for. These are all important, and these are not all inclusive. You will notice several of the great or very specific ones that you highlighted on the prior slide and the word cloud aren't listed here. Partly is that you did a great job of capturing a lot of different ideas, and part of it, I could only list so many things on a ranking slide. But on this Menti platform, I want you to rank the impact of barriers to treatment on the people you care for. Ranking something as first means that that is the greatest barrier that you're experiencing or that your people that you care for experience as it pertains to access, engagement, and or completion of treatment. This is one of those, like, it's definitely, there's no wrong answer here, but it's definitely a more complex item to complete or to submit. Well, we're creeping up on this. I think I got a maximum of 17 players on Menti, so we'll see if I get a few more. I love how much we got over in the Zoom chat. Up to 11. So looks like access to a treating provider is a pretty consistent concern. Also, cost of therapy, which, and the way I framed it, cost includes probably insurance barriers and or funding, whether someone is underinsured, whether they're fully insured, whether they are on a specific program or plan. Prescribing restrictions, I think this is really important to highlight in this audience, is that prescribing restrictions that might limit access to specific specialists, whether they're gastroenterologists or infectious disease physicians, are a barrier for some folks. Completing diagnostic workup, often that's related to cost as well. Other medical conditions and sobriety restrictions are things, and other medical conditions might be from the patient or perspective that there might be other priorities. sobriety restrictions might actually just have to do with the fact that the insurance requires sobriety, participation, and or activity, which is still present on some insurance and or prior authorization forms. Clark, before moving on, do you have any thoughts about this from your perspective? And Dr. Alfaro Cruz might pull you in here in a second too. Are these does this jive with your experience in Memphis at Region 1 with your providers, or in your context as you've tried to help with people in your region?
Yeah, I would say access to a treating provider. It's one of the main things that I hear about why patients have had a hepatitis C infection for 15 or 20 years is because they just couldn't find somebody or didn't know where to turn about who would actually engage in treatment. Now, some providers in the past, they didn't want to treat it because they knew the options weren't that great. But now, since 2014, when the new agents came on the market, it was limited access to those drugs because of cost, and then it became more readily available as the years have gone on. So sometimes breaking down barriers of patients being afraid because they've heard how much it costs, that's been one component that I've heard, that patients don't want to be treated because they fear that they won't be able to afford it even if they do have insurance. So that's one barrier that I'm easy to break down quickly, is to kind of explain what your insurance will pay for, and then what copay assistance or access there is to funds, whether they have a Medicaid plan or a commercial plan or a Medicare plan. There are funds out there that can help cover copays that could be thousands of dollars. So it's more about finding a specific person who knows how to navigate those waters, which myself is one of those. And that's what I can give patients peace of mind, that even though the medications do cost a lot of money, I can still get them medication. Usually my goal is $5 or less for copays. And that really gives them peace of mind that, oh, they've finally found someone that can treat the virus as well as get the medication to be affordable to them. Those are the kind of the main two things that I've experienced.
Love it. And Dr. Alfaro Cruz, I don't know if you're in a position where you can unmute, but any thoughts about this list of barriers as it pertains to pediatric patients?
Yes. So, hello. Okay. Sorry. Yes. So, from a pediatric standpoint, one of the most common complaints that we get is access to a treating provider. As there's definitely less of peds GI hepatologist doctors or infectious disease available in a lot of the areas that we serve. I can tell you from my experience from being at Northeast Tennessee, really your closest GI doctor for a lot of the areas in Virginia, North Carolina, it's either asked in Johnson City or Knoxville. And so that's one of the main complaints. We fortunately get to have improvement by insurance or Medicaid regarding cost of therapy. And that is something that definitely has been a barrier that we have been able to actually control or defeat in this occasion. But the main one is access to treating provider. And so that's why we're trying to talk more to all the local primary care providers in the area, anyone that has access to provide these medications, to actually do not hesitate to contact us. We can always do a telehealth if they need a specialty to provide some guidance, but definitely we want to make sure having access to subspecialty differs from actually treating. I think one of the things that we have been trying to focus more in teaching is about, listen, the treatment has changed. It's very simple. It actually can be more easy to manage Hep C than to manage a complicated asthmatic patient. And so we're talking continuously to them about that, taking the fear away of treating Hep C instead, and having actually not have to wait 6 months to get to a subspecialty.
Well, let me just kind of highlight here. So where I'm going to spend just a brief moment is just kind of speaking to those three top barriers that you all identified. And I've left this open, this Menti page open for comments. And I'm just going to speak briefly about access to a treating provider. If you've got questions or comments and you want it to be on the screen, you can put it in the Menti. I've also got the Zoom chat open that I'll keep an eye on. So you can put either comments or questions here. But when we're talking about access to treating providers, I just want to echo Dr. Alfaro Cruz and Dr. Allen. And honestly, what we've said since we've opened this Project Echo is that that's the entire reason that we're doing this, is actually to facilitate access to care to patients by supporting providers and supporting teams to feel equipped to treat hepatitis C. That may be through the education we provide through this model. It may be through the case discussions in this model to raise your education or to support you on a specific case. But that support really doesn't need to be confined to this ECHO sessions alone. We encourage you to reach out to the ECHO team, to connect with Melissa, to connect with Mia, to collect with our team. And if there are urgent needs about clinical care or clinical questions between sessions, then we want to support you. And that with that be a pharmacy question, whether it be an adult question, whether it be a pediatric question, we're trying to build this framework to support you so that other providers feel sufficiently equipped to adapt and to navigate this. Because I do think that this is an area that I know among providers that I've trained, whether it be in health departments, whether it be in primary care settings, whether it be in federally qualified health centers or others, that this is from the outside something that can be quite it can be quite, I wouldn't say challenging, but it may look from the outside as being more difficult or complex than it is. And yet I will also reflect that this is an incredibly rewarding area of practice to actually treat someone for a medical condition that you can cure, and also is associated with both long-term disease, but also significantly associated with stigma among many populations. And being able to cure that and being able to relieve people of that is something I think that is just really, really important. Barriers, inability for people to find providers is going to be an ongoing challenge. And so that's why we really want to support the people that are here, the people that you touch. If there are people that you know that you think could benefit from a program like this, or to meet with someone like me or Dr. Alfaro Cruz or Dr. Allen, we are happy to do that. And so we want to support the growth of providers, either whether it be you yourself or the people that you touch, the people you interact with within your region. And that's not necessarily limited to Tennessee as well. I want to pause here. If there's any comments or questions, you're free to do it in the Zoom chat, free to do it in Menti. You're also free to do it the old-fashioned way and to come off mute if you want to ask a question about access to providers.
And I actually, Dr. Chastain, I want to kind of echo on something that you said, and it's true that the management of Hep C maybe look more kind of scary from the outside, right? If you're not doing it every day, or if you're not comfortable doing that. But once you kind of realize that with these new direct-acting antivirals that we have, treatment has been so simplified that I've talked to a lot of primary care providers around our area, and they're like, yeah, this is actually a more straightforward path. And I think if we are able to kind of break that barrier of saying we're not using the previous medications that we were using in the past, I think probably we can get more primary care providers comfortable with the idea of like managing Hep C from their clinics too.
I'm going to give a quick pause here, see if there's any questions or comments for folks. I'm watching both screens, but also happy to hear from folks. Rajiv. See, your hand is up. I can't hear you yet.
Sorry about that. It's like trying to figure out where the mute button is on this screen, you know, so joys of technology. Sorry about that. A couple of things I wanted to like bring up, and I think it's also like plays into like that access to care component. It's like one, it's the amount of like misinformation that's out there, or the lack of information. You know, the misinformation, what we're seeing in South Carolina is, it's like this is a moral failing on somebody who may be like who's been injecting drugs. It may be something like, oh, they deserve what they got. You know, there's that really that a lack of understanding, like that. Hey, these this, we have to treat this as a disease. You can't look at it as a social or political aspect. So I think it's really important to like be able to provide that information to the population. Hey, this is a disease that can be treated, or it can be cured, or there's the vaccination if it's Hep B. You know, like, so essentially, I think that's huge for the population to be able to provide that information. The second thing is the lack of information, and that falls on a lot of providers here. They either think, oh, it's too complicated for what I'm trained for, or I don't have the time, or I hate to also say it's like it's not in my patient population, so it's like that's something else that falls into it. And I'm happy to say that the AETC here in South Carolina this coming Friday, we're going to have an end the HIV epidemic conference where hepatitis is also going to play a prominent role. But I think it's focused on the providers to try to get that information about screening and looking at things in a syndemic view, and that it's not as difficult to treat, that things have improved, and there's also resources available to you if you want to go down that road and treat patients. So it makes it easier for you. So I think that's like the education part is very, very important, both on the community side as well as the provider side. So I just wanted to include that there. Thank you.
Rajiv, thank you so much for sharing your perspective, both having been in this region before and also at a state level and in other states, also so incredibly helpful. So thank you for speaking to that. I am going to come back to this question or comment that came up on the screen. But I want to actually, I'm going to call somebody out that I saw briefly, mainly because I'm so amazingly proud of what they have offered and what they have done. And Mary David, I saw that your face popped up very briefly. Do you mind just sharing, Mary, who you are, what your career was, and what you do now? Because I really just want to celebrate that.
Well, thank you, Cody. I'm one of those people who has a whole lot of those years. When I said 45, I didn't include my medical education. I am an old obstetrician gynecologist, and I kind of inadvertently backed into this because in the early days of the HIV epidemic, the folks down at UT, I had been out in private practice for a year and a half, and my friends down at the university called me because a young woman whose husband was in the Navy, and she was pregnant, had gone into the hospital on base. And at that point, the military was pretty much the only place testing. And she tested positive. So they called and told me that she did not belong at the old John Gaston City of Memphis Hospital and asked me if I would take care of her. And I said, let me think about it overnight, and realized I'd gone into medicine to take care of sick people, and she was a sick person. So I called him the next day and said, come up here. Well, after that, incidentally, she was one of the nicest people I have ever met and had the most beautiful 3-year-old daughter. Anyway, I took care of her. And needless to say, in those days, that was until she died. Well, I continued having patients pop up every now and then in little old Dyersburg who were HIV positive. And I took care of them along with the physician who was in the Center of Excellence in Jackson. By the time he decided to retire, I had closed my private practice and was looking for what I was going to do next. And I got asked to come in and talk to the regional director and was offered a job. I was told I could be full-time, part-time. I could even help out with the HIV clinic if I wanted to. And I kind of backed into this because I didn't realize he'd retired. And I said, I'd be happy to help with the HIV clinic, not realizing that I was going to be the HIV clinic. Thank goodness Carolyn Wester was still here, and she was originally an OB-GYN. And she convinced me that I could do this, along with the help of the SEAETC. And I started out coming up to Nashville every week to learn what I was doing. When we started talking about treating hepatitis C, one of the other physicians in West Tennessee was interested in learning it, and I was not going to be included. And I said, wait a minute, I've got the patients who need this. I want to do this too. So I started out with your training courses. And since then, I've got 3 of the nurse practitioners I supervise treating hepatitis C. I'm treating hepatitis C in the health department and in the Brian White Clinic. And it is one of the most incredibly rewarding things to actually have something you can cure and see the difference it makes to the patients.
I just want to can all of that, Mary, and just like spread that and sprinkle it everywhere, and just a huge snaps and claps for you, because this is exactly why we do this type of work. And I know that we've had other people share who have been on echoes and other aspects of, Olivia left an incredibly thoughtful comment about barriers to care, about concurrent determinants and different related resources. And I would say that, yes, those are all things. There's all a chance. What I love most of all is that Olivia's identifying that these are social drivers that are barriers for her patients that she wants to recognize just, and also want to call out Olivia as a nurse and a recent nurse practitioner or graduate who's working at a clinic that is now expanding their resources beyond HIV and beyond HIV prevention to actually treat hepatitis C. And so what I want to say here is that however much time we spend supporting you, reinforcing you, or drawing other people into our circle, I think is incredibly important. One person put in as far as a discussion point saying, well, when is TennCare going to remove restrictions that primary care can provide treatment without the patient seeing the subspecialty? I'll be honest, I don't know. This is something we've advocated for some time. I'm delighted that sobriety restrictions have been decreased and subsequently removed from TennCare prior authorizations, but the specialty provider remains. That is actually one of the things that the South Carolina AETC has done for years, is provide their support and documentation for primary care providers to treat hepatitis C within South Carolina, because there is a similar restriction there. And I would say that Project Echo here, we also want to support you. And if you have a primary care provider, or you are a primary care provider who could treat, is that this framework is one that we have in place to support you, and so that you can say that consultation was provided by a specialty provider in the context of Project Echo to actually suffice that. And that has been successful consistently. And in the very rare cases that it is not, we have been able to successfully provide support with a letter of support documenting that aspects of that case. So ultimately, when I was asked to talk about barriers today, I could have given you a lecture about what's in the literature and what the primary data is and what the charts are in the data. But like I highlighted, you have 300 plus years of experience as a medical provider. You know what those barriers are. You experience them, you live them every day. What I wanted to do as much thing is to recognize that as a group, we are aware of them. As a group, we can identify them, but as a group, we can also address them. And the way we can address them is actually with each other's help, with each other's expertise, and the support of a program like this one. And with that, I'm going to actually pass the baton back to Melissa, so that for those of you who showed up to actually hear about a case, you can hear about a case rather than just listen to me opine. Melissa, I'm going to give it back to you.
Thank you. So give me just